Norovirus is a highly contagious virus that causes gastroenteritis, which is inflammation of the stomach and intestines. Symptoms are nausea, vomiting, diarrhea, stomach pain/cramps, fever, headache, body aches. The norovirus life cycle inside the human body involves several stages. 1. Entry into the body. Norovirus enters the body typically through the ingestion of contaminated food or water, or by coming into contact with surfaces or objects contaminated with the virus. 2. Attachment to cells. Once inside the body, the virus attaches itself to cells lining the intestines, particularly the epithelial cells of the small intestine. 3. Replication. Norovirus replicates within the host cells. It hijacks the cell's machinery to produce copies of its RNA genome and viral proteins. 4. Cell damage and symptoms. The replication of the virus damages the intestinal cells, leading to inflammation of the stomach and intestines, which manifests as symptoms such as nausea, vomiting, diarrhea, and stomach cramps. 5. Shedding of virus. Infected individuals shed the virus in their stool, feces, and vomit, even if they no longer show symptoms. This shedding can continue for several weeks after the symptoms have resolved, contributing to the virus's spread. 6. Transmission to new hosts. The shed virus can contaminate food, water, surfaces, or objects, which can then infect new hosts through ingestion or contact. Immune response and recovery. The immune system responds to the norovirus infection by producing antibodies to fight the virus. Most individuals recover from norovirus infection within a few days to a week. However, some may experience prolonged symptoms, especially in vulnerable populations such as young children, the elderly, or individuals with weakened immune systems. Long-term immunity. After recovery, individuals typically develop immunity to the specific strain of norovirus that caused their illness. However, this immunity may not provide complete protection against other virus strains. Throughout its life cycle inside the human body, norovirus is highly contagious, with a low infectious dose, meaning even a small amount of the virus can cause infection. Proper hygiene practices, such as hand washing and disinfection of surfaces. Practice good food safety habits, such as washing fruits and vegetables thoroughly and cooking seafood thoroughly. These practices are essential to prevent the spread of norovirus. Isolation. Infected individuals should avoid preparing food for others until at least 48 hours after symptoms have stopped. Avoid close contact. Try to avoid close contact with infected individuals. Treatment plan. Hydration. Drink plenty of fluids to prevent dehydration caused by vomiting and diarrhea. Rest. Get plenty of rest to help the body fight off the virus. Medication. Over-the-counter medications such as antidiarrheal drugs or antiemetics, to reduce nausea and vomiting, can be used to alleviate symptoms. However, consult a healthcare provider before giving these medications to children. It's essential to note that there is no specific antiviral treatment for norovirus. The focus is on relieving symptoms and preventing dehydration. In severe cases, especially in vulnerable populations like the elderly or those with weakened immune systems, medical attention may be necessary to manage dehydration and other complications. Always consult a healthcare professional for proper diagnosis and treatment advice.